All right, folks, this is Dr. Faruqi again, and today we're going to talk about the another very important concept in statistics, and I should say in biostatistics, in medical statistics, and that is survival analysis. So I will talk about this concept today, and let's see what we have today in our presentation. So I will give you some little background of the topic. What is survival analysis? Why we want to use survival analysis? I will give you some examples, mostly related to medical sciences. Some important concept that we will talk, and I would like to tell you. I think we will have a couple of presentation on this topic, and let's see how we go. So I will talk about the censoring. We will talk about the descriptive statistics in survival analysis, estimation and test of significance in survival analysis. And folks, I would like to tell you now in the literature, people are not using the term testing of hypothesis or hypothesis testing. Now, people are using a test of significance, right? What are the different parametric method in survival analysis? What are the non-parametric methods? And one of the most important non-parametric method is Kaplan-Meier estimation method. Then I will talk about the semi-parametric method in survival analysis, and that includes Cox proportional hazard model. All right, so let's talk about some backgrounds. Folks, in a chi-square test of significance, your response variable is dichotomous, yes or no, and you can express that variable with the exposure or independent variable, or you can say predictor in a cross tabulation. Similarly, in a linear regression or ANOVA, your response variable is on a continuous scale, right? And we are interested to see how predictors are associated with the response variable in linear regression, and in ANOVA we can compare the groups uh, on our continuous scaled outcome variable. In Poisson regression, the outcome variable is count or rate. And again, we are interested to see how predictors are associated with our response variable. In logistic regression, the response variable is dichotomous, and you would like to see how the risk factors, or you can say again, predictors and independent variables are associated with the presence or absence, with the probability of the presence or absence of the event in your response variable, right? However, in many application in medical sciences, social sciences, behavioral sciences, the response variable is time to event, right? And the subjects are usually followed over a specific period of time, and the main focus is on the time to which the event of interest may occur. So in this situation where your response variable is time to event, survival analysis is one of the approach or technique to analyze your data, to evaluate your data, right? So what is survival analysis? Survival analysis, or you can say duration analysis, is a statistical method in which your response variable is time. You can say your response variable is t, and this time could be hours, months, days, minutes, seconds, years, and so on. And the occurrence of event of interest could be any, could be death, could be disease, could be remission, could be HIV, could be marriage, divorce, first job, right? After your graduation, if you are doing research in social sciences. So it depends what is your outcome of interest, right? So in other word, basically response variable is the combination of two things, two parts. One is the time and other is event of interest. right? Or censoring. We will see this concept shortly, right? And that's dichotomous variable, yes or no. Let's take an example. Folks, in a clinical event, if your interest is in clinic, and if you are in a clinic and the clinical event of interest is heart attack, then the response variable uh, t could be the time in year until a person develop heart attack, yes or no, right? Similarly, survival of patients on the waiting list of the heart transplant program, then the response variable, you can say capital T, can be time in year until a death. So your response variable, your time is in years, and your event of interest is death, right? So we use capital C. Remember, basically we will see this response variable is a random variable. Remember, in a random variable, you say we can denote a random variable with a capital letter and their values with a small letter. Similarly, here our response variable of interest would be t, and that is time, and its values will be small t, and we'll see shortly that the event of interest is death here. All right, patients who went a primary renal transplantation from a deceased, or you can say living donor, then your response variable of interest may be the time to graft failure. This is, some kind of tissue or some kind of that thing. I don't know exactly. This is a medical term that you can Google it and find it. All right, why survival analysis? That's the most important question. Folks, as I said, survival analysis is basically a time to event, right? And if you when we have time to event kind of variable, then you will see the traditional, or you can say uh, uh, you can say the normal analysis that we normally use is not workable, right? That's usually difficult to analyze that data. Why? you know In a least square regression, you assume your response variable is normally distributed, right? But here we will see the time, which is the time which could be a year or whatever it is. It's not normally distributed. It's positively skewed. We will see that, and if it is positively skewed, a simple ordinary regression won't work. So, right? Also, we will talk about the censoring, and if we have a data with such kind of additional information, OLS or logistic regression won't work so efficiently and cannot handle the censoring data. Censoring data, we will see basically the incomplete information. We will learn about that. Similarly, if you want to compare two groups, you can use t-test, right? If you want to compare two treatments, you can use a t-test, right? Or but the problem is you cannot compare with standard. You cannot apply standard t-test or if your response variable is like time to event. Remember, when you are comparing two groups, your response variable is simple. On a continuous scale, you apply t-test. But here again, you cannot compare like that because your variable is of different nature. It's not any more continuous. It's a combination of two things. Keep in mind, one is time and other is censoring or occurrence of the event. So we cannot apply uh, simple t-test. But if you want to compare two groups with respect to time to event, then you can analyze this, the data with survival analysis. All right. Similarly, as I talked in Poisson, uh, linear regression, logistic regression, we if we have a variable which is time to event. We cannot use those standard techniques. But if you want to study the effect of your covariates or predictors to your response variable, which is time to event, you can use survival analysis. All right. So basically, survival analysis is all about the events and when they happen. Look at this line, events when they happen, right? So, for example, death after the surgery, infection after the surgery, after the transplant, right? Hospitalization, right? Length of stay in a hospital, reoccurrence of cancer after treatment, right? Of what's the probability once you are treatment with the cancer? What's the probability after how long you will get a cancer again, right? Marriages, computer crashes, and so on. All these time to events variable can be analyzed with a survival analysis. Let's take some example. Time taken days to get a COVID-19 positive. If you want to study this kind of data, where you have two variables, one is time in days and other is COVID positive negative. So, and then you can make a graph and you know what will be the probability after, you can say, after your analysis of your data, what's the probability of getting a COVID positive for a population and so on. So time 10 years to relapse a renal disease, time 10 years until deaths for an elderly population in Michigan. Since I work in Michigan state, so I took this example. You can take population in Lahore, Dubai, or whatever. You can study that. Okay, time T in year until divorced for marriage population. See, in social sciences, social and behavioral sciences, if you have a data of such kind of data where you have a data individual with years and their divorce after the marriage, you can analyze this data. Time teen month, getting first job after graduation. That's an example of time series, survival analysis data. Time in years having first child after marriage, right? You don't know when you're gonna get that, but at least you wanna know what is the probability of getting that after the marriage, when, how, right? So interesting survival analysis. So time teen month until death after heart transplant. So time teen minutes until cab arrive, right? So these are very interesting data that you can analyze and you can uh, do some kind of decision making, right? Time t taken for a patient to response after a certain therapy. You can compare the mortality of the patients with heart attack, those who went through stent, those who got a stent, and those who got bypass. So you have two group of people with two treatments. One is with stent and one is bypass. Which one is good? How long will one last as compared to other, right? So one of my friend, like he just got stent, and when he went to the doctor, he says you have two options. If you wanna you wanna see the long term effect, then bypass is fine, right? Otherwise, you can go by the stent, right? Both, you can compare these two groups, right? Uh, Similarly, you can, if you have a, for example, you have a nursing home, right? And you want to see the effect of different financial incentive on the length of stay, right? You can use the survival analysis. Time to find the new patient after the period of divorce. So I will not go to some concept and notation. I think it's enough now. So today we learn what a new technique in statistics that is called survival analysis. And this survival analysis technique is very much used in everywhere, but as medical science is people are using this technique very often. Why we want to use this technique? Because here Our response variable is time to event of your interest. So basically the variable of interest is of two part. One is the time and other is the occurrence of event, right? So then we learn different kind of the examples in survival analysis. So I think that's enough for today. Next time we will talk some very important notations and concepts. Then we will go from there. So thank you very much for watching, and you have a wonderful day. Take care of yourself. Bye bye.